Atlanta, Georgia, home of the world's largest airport and one of the world's leading facilities for disease and health research. Multiple transportation opportunities that allow you to venture to one of the many restaurants or venues in a matter of minutes. A thriving city with endless possibilities. But just a few miles from the metropolitan area, the rest of the state looks completely different. Limited resources, poverty, and poor access to reliable health care are a consistent challenge. We quickly see there are two Georgias.
So the coalition has always partnered since we've been able to. And this year we were able to give the kids pencil pouches with a pencil inside and some brochures that Dusty Arnold with Shiloh Behavioral Health made.
Today we are here partnering with all the different vendors in Hancock County to do our first ever health fair in the community.
I think there are two Georgias all over this country. I've lived in rural New York State, which had much of the same problems I'm discussing here, because I find it inherently wrong that folks in Decatur County have no way to access their regular health care. Whereas if I were living in Atlanta and I had an equally income level there, an equally low income level, I could still access health care.
The Healthcare Georgia Foundation established a bold initiative to fund 11 different counties throughout the state of Georgia over a 5-year period. This is the first of its kind for a foundation this size.
We began this initiative with a conviction that work in any community through with philanthropic resources should be grounded in science, built on partnerships, and focused on results.
There was a big disparity between what you saw happening in the metropolitan areas, for example, in metropolitan Atlanta, compared to the rural communities in the state.
The foundation wants to see health equity, wants to see all Georgians have equal access to a healthy life and a healthy future. And our resources alone are a drop in the bucket of what it will take to get there. And we also know that just spending money is not enough to solve some of the challenges that we have to overcome.
I actually remember very vividly being at the Coastal Pines Technical College in Waycross, Georgia, the day of the first announcement, the first public announcement, when Dr. Gary Nelson shared with a group of us that were gathered about this bold new approach that Healthcare Georgia Foundation was going to take, shifting from grant making from limited time span projects to sustainable support over a number of years.
The Two Georgia Initiative was initially constructed around a concept of health disparities. And the closer we looked at that issue, the more we interacted with rural communities, the more the communities stepped up and provided leadership.
We study the 4 census tracts of the county all the time and look at social determinants of health by neighborhood and census tract. So we're actually standing in the poorest neighborhood in Cook County. And while the local library is just a few miles away, the reality is for many families, they don't have transportation to get to the library.
But when you go into the community, we're talking about improving health. We're talking about health equity. Everyone doesn't have the same definition of what that is. So going into the community and making sure that you understand, you're on the same page of what you're trying to accomplish.
We are a county that we feel looks out for their own. So it's kind of hard for outsiders to come in and do things that they want to do. But once they're in and accept it, then you can see progress.
Yeah, it's very interesting because I think with a lot of projects like this, like you say, you're very used to people coming in and telling the communities what to do. So even when I was first learning about the project and learning where I would fit into the project, I was always wondering, okay, well, I don't want to tell them what to do. How do we go about it? And so it's really just about speaking with them and figuring out what it is that they actually need from you, how you can help them, and how you can address those needs.
Being met with a little bit of distrust from the community as to, are you going to come? Are you going to stay? You know, these funds, are you going to be a flash in the pan program and be gone tomorrow?
Traditionally, many funding models applied to the rural communities is based on a system to gain a desired outcome, often manifested by the funder.
I could really give compliment to Healthcare Georgia Foundation and their thoughtfulness about this process. One of the things being different about this grant is there was a planning year, and I'm a doer. I like to just start and jump in and let's get stuff done. But that planning year really served to help us focus, to take a look at the priorities of the community, what people were going to be most interested in doing.
I think that was one of the bigger projects, was having community training and a community listening session, to having a lot of different stakeholders within the community learn what health equity is.
Well, I think a lot of times when we look at the work of making communities healthy and whole, we think a lot about where those communities are and not necessarily about what were the causes that created the conditions that people are living in that create unhealthy environments. And unfortunately, there is an unfortunate history of structural injustice, systemic racism, and oppression that have created the conditions for communities to not be as healthy as others.
Okay, so when you think of health equity, people think that, okay, it means that everything is equal. Okay, it is that in a sense, but making sure that it's equal in a way that accommodates everyone. So if we all can ride a bike, that's good and all, but every bike is not made for every body type and every age range. So making sure that everybody has the same equality when it comes to things that they want to do, their health, making healthier decisions, making sure they have those resources.
It's creating unique services that are targeted to different populations that may have greater need. And so, we use the analogy several times. If you have 3 people of different sizes who are trying to look over a fence to see a baseball game, if you give them each the same size box, you're still going to have deficiencies in the shorter people. Equity means creating the proper size box for those individuals so all of them have the same view.
We created what I call a 3-legged stool of management support, which included community coaching. So we had a team of community coaches who were assigned to each of the communities and were the face of the initiative on the ground in the community, supporting and guiding the coalitions in their development work.
The coaches tried really hard to identify grant opportunities and help them come up with good proposals.
Helping communities form coalitions, work collaboratively, bringing all aspects of a community together.
It's been a long time since there was specifically a rural, multi-year investment in rural health.
And over the course of 5 years, it was over $1.7 million of new grant funding that was come into these 11 communities. I mean, that's pretty remarkable.
Then the second leg of the stool was the equity work. We had at the center equity. It was the North Star of the initiative, and we wanted to keep that elevated. So we engaged the support of our equity technical assistance provider, Partnership for Southern Equity.
The Magnificent Management Team, we are a participant, a part of the team, and our role primarily, starting out as a special project, was to meet with the residents, coalitions, and communities participating in Two Georges initiative around the state. And as we built those relationships, met people, listened to them, it helped us to frame and design what is now Why Health Equity Matters. It's the health and racial equity training that we provide, in addition to technical assistance, providing health equity office hours, and serving as the health and racial equity subject matter experts.
An organization like PSC could add value to the work and really provide guidance around what real success could look like, and even more so, what would be the work required on the ground to ensure that real change would occur, not just for the foundation, but for the people that the Two Georges initiative engaged with.
And then the last leg of the stool was evaluation. We engaged the Emory Research Prevention Center to provide not only overall evaluation for the project, but provide guidance and counseling to the evaluation at the local level, so that the communities could also do their own assessment of their progress and achievements.
I was excited by the focus on health equity. 5 years ago, health equity wasn't the common phrase that it seems to be now. It really felt like this was at the forefront or the cutting edge of something new and exciting. And so I was really excited to get to be a part of it, and to play a small role in maybe the success of the initiative.
Working with Emory Prevention Research Center, they created a bunch of tools and resources to help the communities understand what it means in terms of evaluating with an equity lens. So they developed a health equity metrics list. It was like 10 pages of different ways in which you can look at health equity in terms of a data collection perspective.
A few of the challenges that I faced when initially starting the initiative was really understanding evaluation and looking at how we were going to make sure that it was equitable, that everybody had what they needed, but then also ensuring that we were bringing the right resources to the community. And so that's where I really think that the Healthcare Foundation stepped up and brought in the resources needed in order to make that happen.
Two Georges initiative has also helped increase muscle memory around collective thinking.
The legacy of this initiative is one in which we need to pay closer attention to how the social determinants of health, the causes of the causes, if you will, play out in rural communities. It's not strictly a health initiative. It is an initiative that focuses as much on housing and transportation and childcare and jobs as it does the health and well-being of Georgians.
It's a quality of life thing. You know, we want these folks to be able to enjoy their grandchildren, their great-grandchildren, and we want to know that they're okay. So we've learned in this time that we've had this grant money that there are obstacles to being okay.
Everything else that is done that is supposed to be to benefit the whole community, that accessibility is at the table from day one, or people representing every segment of the community.
When I say poverty, for the poor people, lack of funding. For the people it means lack of knowing of what the other people needed.
I know we talked to several people about needs, about the community needs, and you had one group that thought they knew what the community needed, but actually they hadn't asked the community. So they were just kind of assuming they knew what the community needed, but they really didn't know what the community needed. And when we did our focus groups with the community, we actually found out what the needs were.
the CIDC responded through its mini-grant program toward mini-grant offering in keeping with one of its programmatic goals of active lifestyles.
The Two Georgias initiatives gave us that opportunity to be able to go even further, over and beyond, and be able to buy things, buy curriculums, buy tools, and buy resources that we were able to use to be able to make bigger things happen.
Literacy, you talked about literacy, and I think it's so important because one of the things that literacy can lead to is health literacy. Right. If you, knowing how to read the label on your Campbell soup is really, really good, and knowing how to read the label on your medicine is really, really good. So I think all of these things we found out really tie together.
So basically what we're doing tonight is something that's called Well Fed, Well Read, and it's a program that Community Helping Place is doing where we're going out to some low-income neighborhoods in the area and we're providing food and then also some reading resources for some of the children in the area.
The wisdom and strength of this collaborative approach would prove itself time and again over the next 5 years, both through the predictable challenges of managing a spiraling rural initiative and in the face of many unforeseen events and circumstances to come.
Being a rural, widespread community, it's very difficult to get health care.
And we didn't have any of the infrastructure that you need to start getting ahead. We didn't even have a nonprofit in the county.
Or the one that caretake who stay in Everett County, they got a 9-to-5 job, so they cannot take time off and bring their loved one back and forth to the medical center, take them to the grocery store, take them to get their medicine. So that's where we come in at. We provide 7 days a week. We take people back and forth to the doctor office, back and forth to the grocery store. And like I said, 40% of that, what we do come from the HOPE program.
The office of Dr. Karen Kinzel. And this once was an old Tasty Freeze. I mean, it leaked. It was really not a very good, it wasn't an uplifting place to come to, but it met the needs of the people and it served the people that she served within the medical. Many people can be seen here at Dr. Kinzel's office, and she sees hundreds of people.
We only have 2 ambulances. The county used to run their own ambulance system, but now we don't. We're contracted with Grady, and that's the county that does that. Grady Hospital in Atlanta, and the way that if they get a call in, it has to go through Atlanta, come back, and that kind of thing. So the actual response time is delayed. But the biggest problem is let's say that I have a person with a heart attack. They take one of the ambulances takes them to Milledgeville to a hospital, and you have another person that gets burned cooking a steak on the grill. They take him to Sandusville, and then there's a car accident that 4 or 5 people are involved in, and while both ambulances are out of the county, we have no way to transport.
Many people don't have access to the more preferred foods or access to healthier foods, and so they get what they can. But there's also a very real element in which food brings comfort to people. They self-medicate with food or with drugs. And it's not really that they have such a desire to be unhealthy or that they have such a desire for unhealthy food.
We feed only organic, layer feed and scratch. So the eggs that we get, are an organic egg as well. And extremely healthy for people.
Class time also tended to be focused more on arts and education on paper and not so much outside the classroom. We really wanted to get them out, get them going with their hands, learning things about where their fruits and vegetables came from. We are in the South, so this is part of what we do. We wanted to show them that, hey, you can grow your own strawberries and They were more likely to try their own foods, fruits and vegetables, once they grew them from start to finish.
As a student, it's learning how to prepare these dishes back at home. It's been really helpful for nights when maybe my parents have been working late and they haven't been able to be home to make food.
The bottom-up approach gave each coalition ownership from the start, freeing them to assess priorities, identify needs and gaps, and perhaps most importantly, envision possibilities.
We became the go-to organization for health needs. Here comes COVID at that point.
Yesterday, I had to FaceTime a family member so they can say goodbye to their mom, their aunt, their grandma, and I never thought that we would ever have to go through this without family members being beside them.
And I think with the pandemic, with Athens County being hit really hard and a lot of deaths in the community, in the nursing home being impacted with a lot of residents contracting COVID-19, there was a stall.
COVID pulled back the veil that many of us who've worked in health for a long time knew was there in terms of inequities, but the rest of the world was able to see it in a very different way and understood that where you live or your zip code can determine your health outcome.
Whenever everything was shifting virtual, you had, senior citizen groups, all the way down to elementary school kids who could not continue with their daily life because when things go virtual and you don't have an internet signal, then life doesn't really continue the same for you.
Everybody suffered through that, so doing the best that we can, but still working together, trying to make sure, as a school, trying to make sure our students were fed and educated was a big challenge for us.
So every day I come down here from the lunchroom and organize all of this food. So we have milks, cheese, sandwiches, and other stuff, and this food goes towards people that doesn't have food.
We had a great enrollment, great participation until the hurricane, and then everything just, we all had to concentrate on other things like the community being torn apart.
Right across the Florida-Georgia line, Chris, you have covered serious storms for more than 20 years. I saw on Facebook you mentioned that you'd never seen damage to this extent.
I never have. I've never experienced a hurricane like this before, and I've covered many of them over my many years here at 11 Alive. Number one, the strength and the fury of this storm, but then also the aftermath of this storm as well. When you just pitched to me, you said, and folks, she's right, I'm not in Florida anymore. This is in Georgia. Take a look at this.
This work isn't just about bringing in programs that are expected to be magic bullets, fixing problems of the day.
Because over the past 5 years, we've already seen measurable change.
We were able to branch out and help fund different needs of families.
I hope the future of the program is that it continues to be funded because we can see long-term impact.
It's just healthier people overall. I mean, my wife and I experienced personally how food can heal you. And that's our goal, and we think that partnership is going to make sure that that happens here in West Georgia, not only because we give access to healthier food, but also that we educate people on how to prepare that food and just how to live a healthier lifestyle.